everyone. My name is Nasiru Iliya, and I am here to make presentation about SignCare, which is a solution that is breaking communication barrier between patient and with hearing impairment and doctors. Deaf patients and doctors struggle to communicate. They often use paper and pencil to communicate or use family members as ad hoc interpreters to awkwardly interpret and convey message between deaf and doctors. In healthcare, every second counts and every minute matters. However, Emily, an expectant mother with hearing impairment, faces significant barriers from understanding critical pregnancy instruction to knowing when it's her turn to get to consultation room, to missing appointment, and using family members as interpreters. All this stand on her way to access healthcare services. What is the problem we are trying to solve? What is the problem of using paper and pencil or bringing family members as ad hoc interpreters? Using paper and pencil lead to misdiagnosis, delayed treatment, and poor healthcare outcomes. Also, using family members to interpret directly to the doctor stripe them of their privacy and dignity because they relay their medical condition and reveal their medical conditions to their family member. Aside all this, it's actually a barrier to their fundamental human rights. What if we could break these barriers? What if we could provide a real-time interpreter available 247 in every clinic? So we are building SignCare, an AI-powered communication system that enables seamless two-way communication and conversation between deaf patients and healthcare providers. Here is how it works. The doctor speaks, SignCare instantly converts that speech to text, and then a signing avatar display for the patient. The patient sign, our system interprets those signs and convey them into text and speech for doctors. It is a closed-loop understanding, and at the end of the conversation, the doctor obtains conversation summary and medically aligned transcription. Who are our users? The healthcare providers, hearing impaired patients, healthcare facilities. This is the prototype. This is the interface of the prototype we are developing. And at the end of this slide, I will take you through the entire process. So we are using technology. We are using two-way speech to text and text to speech, as well as text to avatar. We are using localized Rwandan Sign Language dataset with medical vocabulary to accurately interpret both conversation from both ends. And we are thinking to actually move towards cloud for telemedicine and reliability. But at the start, we are focusing on locally deployed solutions. Who are our competitors? We have noticed SignAll, HandTalk, as well as Ava as one of our competitors, together with, but however, we are actually different in so many aspects, as you can see from the other ends. We are focusing solely on medical transcriptions, and we are also deploying offline solutions as well as supporting local language translations. This is our business model. At the start, we are focusing on antenatal care as well as emergencies, but we are trying to expand to other aspects. But basically, we are focusing on that. And our model is B2B2C, and hospital, NGOs, community services, as well as subscription per use. And when we move to telemedicine and telehealth, we integrate that and also explore those business models. We are making a very good impact in terms of SDG 3, 10, 9, as well as 5 and 17. This is our roadmap. We hope by the end of February, we are to deploy this solution in at least 2 clinics so that we receive early feedback and incorporate those feedback from the actual user of our systems. And we are also hoping by the end of March 2026, we partner with other stakeholders and scale across the nation as well as across the entire continent and the world. So we are asking compute resources, Rwandan Sign Language datasets, we expand it, we deployment hardware, and we are asking about patient Bellman visit receiver as well as other devices and hardware. We are also asking financial support to validate and localize and harden our MVP. So at the start, this is the team. We hope that we'll be able to get additional support from other team and from other members. Thank you so much. Together, we can break this communication barrier and make healthcare services accessible to everyone. Let me take you through the demo. So basically, this is the demo where we host it on the Basel app, and you can actually scan and interact with it. So this is the homepage, which we assume that it's actually a homepage of a doctor that's that is authorized to view this functionality and use. So yeah, basically this is the homepage, and here it's a book appointment where you can book an appointment. A patient can book an appointment or a staff can book for that patient. So you enter his name, his phone numbers, all this information I'm entering actually are not real. Yeah, so the patient can indicate whether he or she is trying to communicate using sign-based communication or using text-based communication. If he chooses sign-based communication, this is where the sign avatars and designing avatars is supported, and then you can move to the department if you know, or if the staff is the one filling this information for the patient, the staff will be able to select the department and then the time of the visit. And yeah, so after booking successfully, you have booked, you are now moved into the patient queuing, who are patient waiting to actually attend to different consultation. So at the consultation, we believe that this facility will be installed and you can see all the people or all the patients that are waiting to attend to. So in this demonstration, you can see that some of them choose signing as the way of communication, others choose text, and so on and so forth. So let's go and call Jane Uyimana, who is a patient that chooses sign as her communication method. So when you click here, a message is sent to her that she should proceed to room 2 for consultation. And then we hope to this patient will be given a Bellman wrist device, and she will be able to receive a vibration and this notification. So it will proceed, and then when Jane Uyimana arrive room 2, and conversation can start if the doctor initiates the conversation. So when I click start conversation, it will take us to the start conversation medium. And this is where, as I'm speaking as a doctor, it understands this, and then the avatar is displaying, and then this is the patient view where the patient can sign, and it's recognize the signing and everything. So here is a simulation of the conversation. The doctor speak, good morning, how can I help you today? The patient sign, I have been feeling dizzy for the past 3 days. Doctors responded, and so on and so forth. So this is how the communication goes. And at the end of communication, the doctors end the communication, and the medical summary is actually stored. So the doctors can go to medical summary and view communication that takes place with Jane Uyemana. And basically, this is the communication that took place between the patient and the doctor. And here is a clinical note that can support their medical decision. Basically, this is not a prescription, or this is just a communication that can help the patient, that can help the doctor understand the patient's medical condition so that a very right medical treatment and services will be rendered. Yeah, so that is it. And let me take you through a patient that chooses text as medium of communication. Yeah, so this patient chooses text as medium of communication and he's asked to proceed to room 2, which we assume he's going to receive also a vibration. So start consultation. So in this aspect, the consultation we here the patient will be able to type and read while the doctor speaks. So the doctor asks questions and then the patient type, because we assume that the patient will be able to write, is literate and will be able to write. So when he writes and the doctor asks, so the communication can go on. The doctor speaks, "Good morning, how can I help you today?" And then the patient type, "Good morning, doctor. I've been feeling dizzy for the past 3 days." The doctors speak, "I see. Can you describe the dizziness? Is it constant or does it come and go?" The patient it comes and go mostly when I stand up quickly and also have. So we assume that this is what the patient is typing and is capable of typing this in their either local language or in English. And at the end of the conversation, this is actually stored, and yeah, and then a consultation summary can be viewed here by the doctor and see how the compensation and everything was. So yeah, basically this is SignCare. This is what we are developing, and we hope with this we'll be able to solve communication challenges and barrier in our healthcare delivery. Thank you so much. Thank you, everyone.